is George Weber. I'm the President and Chief Executive Officer of the Royal Ottawa Healthcare Group.
Hello, I'm Joanne Lowe, and I'm the Executive Director of the Youth Services Bureau of Ottawa.
Hello, my name is Mario Capelli. I am the Director of Mental Health Research at CHEO.
Mon nom est René Ouimet. Je suis de l'Association canadienne pour la santé mentale à la section d'Ottawa.
My name's Ernie Gibbs. I'm a mental health counselor for GLBTQ youth here at Centertown Community Health Center.
I'm Petra Duchner, and I am the Manager of Mental Health and Critical Services at the Ottawa Carleton District School Board.
I'm Phyllis Grant Parker. I'm the Executive Director of PLEO, which is the Parents Lifelines of Eastern Ontario.
My name is Isabel McNider, and I'm a Family Navigator at PLEO.
My name is Ted Charette. I coordinate the Mobile Crisis and Intake Services here at the Youth Services Bureau of Ottawa.
So I'm Ezra Levy. I'm the Medical Officer of Health here in Ottawa.
My name is Cherry Murray, and I work for Crossroads Children's Centre.
What it has is it brought all elements of the community together that could have an impact on suicide prevention. And so for the first time ever, we've been able to bring hospitals together with school boards, with community colleges, universities, the police force, Ottawa Public Health, and community agencies all together, and the funders, different ministries, the Ministry of Children and Youth, Ministry of Community and Social Services, the LIN, and put all the players in one room on a regular basis and try to have an alignment. And that has led to a lot of different things. People, I didn't know that. I didn't know that. Maybe we can cooperate on that. So, I mean, it's trying to align, to work around these funding silos and to try to have more horizontal work as opposed to vertical work.
So one of the new services that we offer that I think is important to talk about is the Bridges program. This is quite a new service. It became available less than a year ago, where we partnered with the Children's Hospital of Eastern Ontario, the Royal Ottawa Hospital, Ottawa Public Health, and of course YSB to deliver a multidisciplinary team that offers treatment to young people 12 to 18. And the goal of that particular program is to have it situated within a community-based agency, so it's physically located at YSB. And it's an integrated team because there are staff who are part of the team from all of those different partners. So it's an opportunity for us to actually intervene as soon as a young person leaves an inpatient unit at CHEO or the Royal Ottawa to offer a very intensive service to those who need it the most, when they need it the most.
The hope of the crisis program is to provide youth and their families another option instead of going towards more intrusive services such as child welfare placements, contacts with police, and visits to the emergency room.
So the nature of my work, I sometimes see people who are being referred from the ERs who could benefit from seeing someone in the community who specializes in sexual orientation and gender identity issues. So sometimes at the moment of the crisis, when people are reaching out, it's really important for them to reach out to someone when the crisis is over and they're not in immediate danger, with someone who's very comfortable with sexual orientation and gender identity issues, so they can talk about those direct connections in their life and build a sense of resilience, how to cope.
But the emergence of the Suicide Prevention Network has been a real step forward in this community. Every agency involved, and there are dozens of them, as you know, focusing particularly on the needs of children and youth, particularly on the needs of as we move into the future, of that part of the sector of youth that sometimes feels disenfranchised, people who get bullied, people whose particular gender choices and sexual orientation has in the past made them targets for bullying, made them targets for teasing. These are things that we want to address increasingly into the future, and the network's focusing its attention on that. It's a tremendous achievement.
I feel that this service is a huge benefit to families. It reduces the stress, it reduces the isolation, but most importantly, it really empowers family. Empowerment is a word that's used a lot in communities, but really what it means is that the people who are vulnerable, the people who are facing challenges, feel equipped to face those challenges and feels like they have the capacity to meet those needs. They're the ones that are doing this every day. They're the superheroes. So we're giving them the tools, the resources, the support to be able to help their families and help their peers. And what's great is everyone at PLEO is a parent of a child with mental health, mental illness, and so we've all lived it and we all feel like we can now give back to others. So we're really empowering the families and the communities to be able to support these children.
Our clients have had the same experiences that many clients report, and that is it's so hard to find the help that people need. And when we came together as a community suicide prevention network and we started looking around at what were the goals that we needed to focus on, that was one of the things that rose the most immediately to the top, and so that was one of the major goals that we tackled.
Over time, the resources available to students and their families and the training that's been done with staff has had, I believe, a significant impact. It's helped to reduce stigma. We're certainly seeing that there's a greater openness and more conversation around suicidality. We're also finding that as staff are becoming more aware of signs and symptoms associated with depression and suicidality, they are feeling better equipped to be able to work with students. It's increased their confidence to be able to talk with students when they're worried about them.
My experience is that it's been very hard to access mental health services, especially in Ottawa, since the kind of push for more mental health awareness has come into play. I think that as more awareness was being brought forward, more people were coming forward and saying, like, I have mental health problems and I need help, but then there wasn't, with this push of awareness, also a push in increasing services. So there was all of a sudden a lot of need and not enough services for everyone, and so through that, I mean, I guess I haven't always received services in a quick, timely manner as I might needed.
When we're looking at gaps, I think, there's a couple things that we need to think about. From as a clinician scientist, the first thing we always ask ourselves, why is it that we're spending so much energy and resources in studying suicidal risk in children and youth and still haven't accomplished the goals that we wanted to accomplish, which is to reduce suicide in children and youth. And I think a huge gap is that we are taking either a very snapshot picture of what's going on and therefore fail to follow kids, from the early onset of risk, through time. So I think the fact that we lack what we call longitudinal studies is a tremendous gap. And I think the other big gap is that we lose our ability to follow youth, and because we become institution based. So hospitals only look at hospital based services, and universities only look at university. And I think that one of the things that we need to do is to is to have less of those institutional silos and look at it from much more of a community-based approach. And I think that is a huge gap that exists not only in the evidence but also in terms of service in the community and in specialized services. So the fact that we are able to look at it more systemically within a community, I think addresses that primary barrier.
It takes a lot of time to get help. It takes a lot of time. Sometimes it's only 2 weeks. Oh, it's not that much, 2 weeks or a week. But for us, when hours are you've been there for 10 minutes and feel like hours because you're hopeless and you really need help, you're really not going well.
The biggest barrier is really the funding silos. I guess the way different agencies and hospitals are funded, we're restricted in some areas in terms of how we can handle the treatment in terms of the continuum, with the funding coming for mental health and addictions from a variety of different ministries. There are very clear, there are funding silos, less program silos, but there's funding silos that restrict how money can be used to provide a better continuum of services.
We do have some pretty significant gaps in terms of community-based treatment services. So we would need, if I could say one thing, I would say that we need to build our capacity at a community-based level to actually work and to continue to work in partnership with the hospitals to offer better transitions among our services and between our services.
What we need to do to keep those gaps from happening, we need to have a system that is strong and vital at each stage that it needs to be, so that we don't have the gaps that are there, or if gaps develop because something new has come along, we can turn them around more quickly, and that's our biggest goal.
Only one. Well, no, I don't mean that as a bad thing, but well, for the time is just to hire more people, but that's not as simple as it sounds.
Améliorer les services de transition pour pas que les jeunes tombent à travers les gaps qu'on voit à travers les services de transition.
We've come up with this project to, by 2020, to reduce suicides by 20% in Ottawa by 2020. That's one of our research projects that's being put together now, looking for funding.
Also having that team aspect, so like having a meeting with your doctor, your psychologist, your social worker, everyone involved, just so everyone's on the same page. I think that would be a good way to start.
To access youth where they are. So going into schools and that sort of stuff, it sounds corny because everyone says it, but really it's not being done. So I think if we keep saying it, it will eventually be there. Having like a distress center or a phone line that you could maybe text instead of call, because I know a lot of youth find it very intimidating to call a service versus texting or instant messaging online or that sort of stuff. So I think that eventually can move towards more social media type thing, but obviously let's keep the in-person for the serious stuff.
The resources that have been provided, the where to go for support, I think has been really helpful. We've been able to provide those little brochures to all of our schools, and they disappear very quickly, which means that students are taking them and looking at them and making use of that information. So I think overall there's been a lot of work being done in terms of increasing awareness and, more importantly, reducing stigma and ensuring that there is access to support.
I think it's developed a wonderful tool for navigation for parents and other people who might be worried about children and youth, which is being distributed at large. And then as well as just having received, the program around resiliency in the schools and training, which I think will help very much.
And what particularly relevant from a research perspective is that we have this other committee called the Research Action Area. And if you look at the composition of that committee, it involves individuals from across organizations, from teaching university hospitals, from adult hospitals, from public health, from community service providers, the university. And what makes it particularly relevant is that it allows us to study suicide, suicidal ideation, suicidal plans, and suicide across the developmental spectrum, across different expertise domains. So if you look at the evidence out there, oftentimes it comes from particular groups of researchers, so it comes from hospital-based researchers or university-based researchers, and there's a disconnect between academia, universities, and the community. And we are incredibly fortunate to have this committee that can thoughtfully design, projects that include, individuals across those specialties and includes both hospitals, universities, and community. It's incredibly unique.
I think that the Suicide Prevention Network has been an amazing addition to this community. I clearly, as a parent, know that Ottawa is a very caring community, and it's certainly been exemplified by over 50 agencies getting together to address this issue. One of the key areas, I think, and I say this because it's had personal impact for our organization, is the network's decision to make navigation and support for parents a priority goal. And in doing so, we're able to support our service to provide a telephone helpline. So now we have parents, we call them family navigators. They're parents themselves with lived experience there to answer our helpline, so parents can pick up the phone and get not just someone who can listen to them, but somebody who actually hears what they're going through. And through that process, our navigators are able to connect them to services that are available in the community.
What I think is really great about the Community Suicide Prevention Network is it is reaching out to marginalized communities, to the GLBTQ community, and to service providers who work with them to say, how can we work together in order to create better understanding of the needs of this population, and how can we build suicide prevention strategies and intervention strategies that are really going to work for this population.
The best way to describe the Suicide Prevention Network in Ottawa is that it's a coalition of the willing. So this is a group of people, individuals and organizations who came together because they cared and because they wanted to collaborate to actually do something at a larger community level. Each of us has a very significant interest in wanting to prevent youth suicide in our community. And I think probably one of the most substantial successes of the network is that we were able to bring a number of organizations and people together to actually work collaboratively and to actually put a number of different things in motion. So the parent navigation service, the Know What to Do guide that we produced, those were very quick. The turnaround time for those kinds of initiatives to occur was astounding. And they came out of real conversations with young people and with their parents who told us that they really were having a hard time knowing where to go to get some help. And we know how critical it is for people to get the help they need when they need it the most.